It's important that we have a registered nurse on every campus in LISD because every student deserves a school nurse. Every student deserves a school nurse who's going to respond to their medical emergency. They're going to be there for maybe a short-term medical need, or maybe they come into our schools with a medical need and we immediately address it and partner with the family to make sure that they come to school safely. Or maybe in their educational career they develop a medical condition, and we're going to be a part of that. And every kid deserves to have a school nurse to help them be successful and meet their educational goals. LISD goes the extra mile when it comes to healthcare because we have a health services program. We're not a silo, we're not one nurse, we're 80 strong. And when you have the support of a school board, you have the support of district administrators, and when a student comes in and there's some unusual medical needs, etc., we've got a team that pulls together, and we're very powerful in our community partnerships with our hospitals, some of our medical providers, our doctors' offices, and one of the most important collaborative relationships we have is with our public health officials. So when we have a communicable disease problem, they're working with us and they're helping us come to the best solution. So having a program, to me, is one of the most important things that our district does. What sets LISD Health Services apart from other districts or other schools is that we're communicators. We have standards on communication that exceed any standard out there that I know of. And when your student comes to see us, they leave the classroom because they don't feel well, we're going to assess and treat, and we're going to give you a call. We want you to know that your student felt ill enough to leave a classroom, and that communication piece also allows us to provide some education. It allows us to maybe collaborate as parent and healthcare provider and go, that happened the other day, and now it's happening again, and maybe we help identify some significant health problems. Where we also communicate and exceed expectations compared to others is our piece with teachers. When we develop a student health management plan, we meet with the teachers. So if this happens in the classroom, here's what you're supposed to do, teacher. If they're on the field trip, here's what you're supposed to do. And those plans are developed with talking with the parents and the nurse coming together, and sometimes other people in the building that need to be a part of helping make that student's educational day positive. The culture that we have when we're hiring a nurse and developing them and making them a part of our program starts at the beginning. We're very thoughtful in our hiring process. When you get on with LISD, just like in any position, it's pretty much an honor, and no matter where you go in your career, if that's a part of your resume, it's a strong statement. And part of our training is it's top notch. We've been ahead of the curve in North Texas for years, in that our nurses are responder team members, they're certified instructors for CPR and AED, they're certified stop the bleed instructors, and they're constantly training on some of the most latest medical needs that our students have. So we have a very thoughtful program and a very rigorous accountability system for our nurses, and it's kind of standardized the level of care that we expect. Because again, every kid deserves a school nurse and every kid deserves a good school nurse. One of the beauties of school nursing that is different than other in education is a teacher is a kid for a year. We've got them for 5, 6, 3, 4 years at a time. And so the privilege of getting to see these kids grow and self-care and be their own advocate in their lives and in their health care is there's nothing more gratifying. Nurses are seen as the most trusted profession in the world, not just the United States. And I think that children feel that as well, that they understand that when they walk in, that there's no judgment, that there's empathy and support. And that's the kind of culture that we try to promote in our clinics every day. And it's important. It helps so many kids. I just can't even tell you.